Hello, my name is Laura. I am an urgent response nurse for the Connected Palliative Care team. My team, the urgent response team, work alongside all the different services we have in the community, so the district nurses, the GPs, the community specialist nurses, to provide care for patients in their home at end of life. We don't necessarily have a caseload or anything that we have to do on a daily basis. So when crisis calls come into the hub, we're able to go out and provide support, assess patients if they've got infections, and then liaise with all the different services to ensure that they're kept at home and where they want to be. I think our team makes a difference to the patient's journey because we're available 24/7 for our patients. So if they are experiencing pain at 3 o'clock in the morning, they can call us. If the family needs support at 4 o'clock in the afternoon and they need to talk things over, or they're worried about anything particular, we don't have a list of things to do in that day, so we're available to go and do what they need when they need it and provide them with their support.
Hello, my name is Aimee Hughes. I'm an end-of-life care facilitator for the Connected Palliative Care team. My job involves triaging calls that come into the hub. They could be from patients, relatives, health professionals. We also coordinate care in the hub, so it could be through the phone, like arranging packages of care, arranging specialist palliative care beds. We also go out to nursing homes and GP surgeries to ensure patients are comfortable. For example, we managed to coordinate care for a patient moving from this area to another area where his niece lived, and managed to get him into that nursing home within 24 hours. Without this service, that wouldn't have happened. So our role improves patients' experience because we're able to offer them what they want. We try and do it in a timely manner. As I say, 24 hours into a nursing home, that wouldn't have happened before. And basically we're just there at the end of the phone, so you can have like distressed relative phone up, really don't know what to do, just talk to them over the phone. They've got someone that they can just ring up and talk to, and somebody will listen to them and advise them appropriately. So I think by us all working together as one whole team, we're able to continue the patient's journey of care as what they would like, with the teams liaising with each other. So it could be community team liaising with the hospital team and making sure things are in place in hospital, then out in the community as well when they're discharged. I feel that it's important to make sure that every end-of-life patient receives the care that they want, and that we do the best for them, because we only get one chance to get it right, and that's really important. And it also helps the family on their bereavement journey following the death of the patient.
I'm a care coordinator at the Connected Palliative Care Hub, so I help to look at the social aspect of people's situations, make sure everything else is in place. We've got all the wonderful nursing team making sure the medications are right and people are out of pain, whereas we try and focus on the holistic side, so we make sure that the carers are coping okay. If they're worried about managing the house, we work with our partner agencies to provide domestic or respite support, and I go out to review that quite regularly to make sure it's working for patients. I think the care coordinator role complements the medical team, because in a way we can free them up so they focus on all their specialist needs. They focus on getting the patient completely out of pain and comfortable, and we can take a little bit of that pressure off and try and make sure that everything else is working. We can make sure equipment is in place, people aren't worried about the financial situation, and just try and ease some of those extra burdens that people experience at this time of their life. I think this adds a lot of value to the service we provide. It takes a lot of pressure off families that are really close to breaking point a lot of the time. So if we can just put in small steps to relieve that pressure, it really makes a big difference and really supports people throughout this journey that they're taking. A major part of why the model works is that everyone's together. We're located close to each other, so the specialist palliative care team are here. We can bounce things off them if we need to. We have urgent response who can go out immediately for patients in crisis, and we have facilitators, which are trained nurses manning the phones the whole time as well, so 7 days a week. Someone has access to medical support if they need it, as well as social support and a listening ear. Okay, it's a really big privilege to be a part of this journey with people at such a vulnerable point in their lives, and people really open up and take you in and share personal things when they're at their most vulnerable, really. And it's so rewarding to know you've been a part of making their wishes a reality.